Hi, I'm Dr. Janelle Jackman, and today I'm going to talk about egg freezing. Do you want to live forever? Forever young? Well, egg freezing is a form of fertility preservation, and you could think of it as a way to remain forever young. Not you personally, but your eggs. So, as you know, women are born with the amount of eggs they're going to have for a lifetime. And actually, the most eggs we've ever had was while we were still in our mother's wombs at about 20 weeks of gestation. So, as we get older and as we age, our eggs in quality and quantity decreases. So, um, we don't remain with the number of eggs and we don't reproduce or regenerate eggs over time. So we're born with the maximum amount of eggs we'll ever have living, and as time goes by, that egg quality and quantity just declines until about menopause, where we're stuck with about 500 to 1,000 eggs. But these eggs typically don't ovulate and they're usually not of any good quality. So egg freezing is a form of fertility preservation that allows you to freeze your eggs at the age that you are at the time you do the procedure. It helps to keep your eggs forever young. And in that way, even if years after the fact you choose to get pregnant, the eggs, which is a crucial, quintessential aspect of pregnancy, is time frozen at that age. So, for example, for me, if I do my egg freezing now, I'm in my 30s, it means that even if 10 years go by and I'm now in my 40s, my eggs are still 30 something year old eggs. So that's why I consider egg freezing, because I'm not yet having children. Clearly, I am not married. So for me, it was a personal choice to proceed with doing the egg freezing to be able to preserve my fertility at this stage where I still have a good chance of being able to use these eggs at a later stage when I'm ready to be able to have a baby. Now, obviously, when you freeze your eggs, you're freezing it just the egg portion, the female contribution towards the pregnancy. Some people would choose to fertilize these eggs if they have a partner or if they have a donor, and therefore that'll be embryo freezing. But this video is not about that. This video is just about egg freezing, just freezing the eggs as they are. Now, when we say freezing the eggs, it's not that you're just going to pop the egg in a freezer, obviously not. It's a special process called vitrification, and that replaces the fluid in the egg with a special medium and flash freezes it so that the egg remains in its exact integrity. It's kind of like, it kind of forms like a glass, as opposed to when something is frozen, typically how we know freezing to happen, it expands. Vitrification doesn't allow for that expansion, which is good because you don't want to damage the egg. So it's a perfect process to freeze the egg, capture it exactly how it is at the age of when you froze it, and therefore preserve your fertility. It doesn't mean that you ever have to use these frozen eggs, because when I do decide that I'm ready to have kids and I may get pregnant on my own. I may never have to resort to using these eggs. Another thing that you have to be aware of is that freezing your eggs doesn't guarantee your baby either, because we have no clue of the quality of the eggs. There's nothing that you can do to test the quality of eggs or sperm. We can test the quality somewhat of an embryo, which is the combination of the two when they start to make a baby, but there's nothing that we can do right now to test the quality of an egg. So once we freeze the eggs, we would hope and pray that there are some good quality ones, but there's no way to know that for sure. So I like to think of egg freezing a bit of an insurance policy, but it's not it's not 100% insurance policy, because you really don't know what you have until you try to use it. But it gives you a little better outcome than if you're now in your 40s or nearing your 50s and you're trying to use eggs at that age. Obviously it'd be much more difficult than using eggs at however old you are at this point in time. So that's my reason for doing egg freezing. There are many reasons. People delay childbearing because they're pursuing career goals, which I'm also pursuing career and educational goals. So people have career goals, educational goals. Some people don't have partners, waiting to get married, or waiting to a certain stage of their life. Other people do it because of health reasons. So, for example, if you're going to undergo chemotherapy, radiotherapy, cancer treatment, if you're going to have some procedure on your ovaries, all these may be considerations, reasons for you to consider freezing your eggs, so that at the point in time when you're ready to have children, it doesn't jeopardize your future fertility. So this is all I'm going to say for this video for right now. This is a whole video series going into an in-depth explanation about egg freezing, including my personal short-lived journey of the process. And I hope you stay tuned and you will get a little bit more out of egg freezing daily. So have a good day. Bye bye.